Hi, this is Dr. David Stoker, board-certified plastic surgeon in Los Angeles with our beautiful patient here who's 26 years old, and we're going to be doing a rhinoplasty surgery on her. She flew in from Barcelona, Spain yesterday in preparation for this, and she's looking pretty fresh given all the traveling she's been doing. The key thing we're going to be doing here is her nose. That it's a little bit bulbous in the tip. I think from the side view here, the dorsum looks great. There's no bump there. And the angle of the tip, the nasolabial angle, which we see here between the lip and the nose, it's right about 95 degrees, which is pretty optimal for a female. So the focus is really the tip. What we're going to do is an open approach to making a little tiny incision underneath here, lift up the skin. That gives me a very precise view of the nose and the cartilages there. And we'll remove basically the upper half of this little hemisphere here. There's one upper lateral or lower lateral cartilage here and another on the opposite side. We're going to shave that down. It'll allow her to have a little bit more definition in here so that the tip is confined to this region here rather than the entire area. Very importantly, because she looks great, I don't want to change everything about her nose. I want to be very selective in what we're doing. I think it's going to give her a really natural appearance. I think that as she ages and those cartilages stiffen and in general get more bulbous, it's going to appear more elegant and feminine. I think it's going to make you happy. What do you think?
Yeah, I'm excited to see the results. For sure.
All right, well, cool. Well, let's go do it. Okay, we're ready to do our next case, which is going to be a rhinoplasty. This beautiful 26-year-old patient who flew in from Europe. She looks pretty good to begin with, but what is most concerning to her is the bulbous tip in this area here. If you look at the profile view, it's a pretty nice profile. There's no dorsal hump there. The nasolabial angle is looking good to me. So we're going to focus really on the nasal tip. Also, I should mention her functional breathing, it seems to be just fine as well. So more than most cases, we're going to focus on one key thing, and that's your nasal tip. So what we're going to want to do then is to bring in the tip here in the upper portion, to bring this in to get a little bit more definition there and create what we call a super tip break, or a little bit of differentiation between the nasal tip and the dorsum here. So it'll be relatively subtle, I would say, because you don't have a big nose, but I think it's going to make a really nice difference for you. I'm super excited when you bring me good materials to begin with. You're pretty to begin with, even if I don't do anything to you. With a few little tweaks here and there, it can be really impactful. So I'm excited to get started with this.
I'm excited.
Are you glad to be here in Los Angeles for the surgery?
I'm really glad to be here, and I really trust Dr. Stoker, so I'm excited to see you.
Yeah, I know. I just as an aside, I know you saw a lot of different doctors, right? Have a lot of different experience. I mean, you got on a plane to come from Spain for this, so you must be feeling, obviously you like the way everything's unfolding here. And
definitely. Yeah, I have a great feeling about this.
Good. Me too. I'm glad you're here, and I'm going to take good care of you. See you inside in a minute.
Okay.
So here we have a 3-week post-op result very early on. Usually I would expect a substantial amount of swelling, and she does have swelling, but she still looks beautiful. The tip, which was significantly bulbous before for a petite female, is now much more refined, and you're going to continue to see more and more definition as the weeks and months go by. The dorsum has a really natural appearance to it. We've got what we call a super tip break in this area here, which differentiates the nasal tip from the dorsum. It's considered very desirable. I think she has a great looking profile. It's a natural looking result. It does not look artificial. Even early on, already 3 weeks out, I bet you're feeling pretty good about this, huh?
Really great. I'm so happy with the results.
Yeah, and how does it, I mean, you're beautiful to begin with, but it can't help but make you more self-confident, I would say, to do this. Is that right?
I'm much more self-confident now.
All right, well, good. I'm so happy that you flew out for this, all the way from Barcelona, Spain.
Absolutely, it was totally worth it.
Yeah?
Yeah.
Yeah, well, maybe someday I'll do a house call in Barcelona, Spain to check on you there
Yes,
with my family.
That would be amazing.
That's a great town to come from, but LA is pretty nice too. And I think
Yeah.
when it comes to plastic surgery, this is the place to be, huh?
Exactly, and this is the doctor to go to. So.
Yay! Dr. David Stoker here in Los Angeles.